Welcome to Kegels to 3D Pelvic Health. My name is Hillary Valentine, and I'm so happy you're here watching this. This is the reformation of a talk I've given for years now called Pelvic Health 101, but I've changed it to From Kegels to 3D Pelvic Health. And the reason is when I tell people I'm a pelvic floor therapist, the first word out of their mouth so often is, oh my gosh, Kegels. And what I wish that people knew is that Kegels is such a little tiny part of your pelvic health. And really, what we want is this more 3D view of what pelvic health is. And what they would start saying, what people would start saying if they had this perspective of pelvic health, instead of, oh, you're a pelvic floor therapist, Kegels, they would be saying, oh, you're a pelvic floor therapist. I desire to connect more deeply with my pelvic health because I know it would impact me in so many beautiful ways. Or, oh my goodness, I connected to my pelvic health and it changed so much for me. So, this much broader, more expansive idea of the pelvic floor and pelvic health. So, let's dive in. First and foremost, I want to be clear that nothing in this workshop should be construed as medical advice. I will be talking about a lot of medical-oriented things, diagnoses, symptoms. This is purely for educational purposes. If by the end of this workshop, you feel that you might have something going on and you're feeling a desire to seek out more support for pelvic floor therapy or pelvic health, your first step would be your primary care doctor or your OBGYN. But I also then would recommend that you seek out a pelvic floor therapist such as myself. I do provide virtual services, so you can always reach out to me no matter where you are watching this from. Okay, a little bit more about me if you don't know who I am already. My name is Hillary Valentine, and I am the owner of HV, Hillary Valentine, Holistic Health. And I am a perinatal holistic women's health coach and pelvic floor therapist. So I don't have perinatal written down there, but I really do primarily work with women in and around childbirth. So the years leading up to childbirth, the year or two, so pregnancy included, and the first 5 years, 7 years postpartum. But truly, once you've had a baby, you are forever postpartum. And I am forever interested in working with women who have had children. So, on a side note, who am I really? What am I in my real life? So, I am a mom of 2 beautiful girls. This is Victoria and this is Gwen. This is an older picture, but they are currently 5 and 7. I love surfing. I love yoga. I love meditating. I love a slower pace of life and really try to take intentional action every day to slow down. So, coffee, walking barefoot are my roots to slowing down. All right, before we get into the nitty gritty around Kegels and pelvic floor and pelvic health and what is all this, I want to tell you a little bit about my own journey because I think it's true for many of us that we go into work that feels really soul aligned because we've navigated something challenging in our lives. And as odd as it may sound, I've been navigating pelvic floor problems, perceived problems in my life since I was about 8 or 9 years old. I started playing softball around that age, and every time I would get up to bat or was about to get up to bat, like the person in front of me was batting, I felt like I had to pee my pants. And I would run crying over to my mom. I have to go to the bathroom. I'm going to wet my pants. Oh my God. And I'd be freaking out. She'd like shuffle me off somewhere and we would never be able to find a bathroom. And sometimes I would just like pee a trickle in the parking lot or I wouldn't go at all. And she would calm me down and I'd be able to return and I'd be okay. But there was so much misunderstanding. My mom had no idea what was going on. We just kind of labeled like Hillary has a small bladder. And there was a lot of embarrassment around it because like other children certainly saw me like standing to get up to bat and then like running away in tears. And it was really kind of traumatizing to me. So I really didn't talk about it much. Fortunately, I was mostly a swimmer, and you can like sneak out of the pool and go pee, or you can be in the pool. I know that sounds horrible, but it is the truth. That's why they use chlorine. Um, so I just did band-aids. Like I participated in activities that you didn't have these like on the point times up at bat with no bathrooms available, like in the middle of the field, in the middle of nowhere. I was a swimmer. There were always like a bathroom by the pool, right? Um, and I also started having this mental map of where every bathroom was, no matter where I went. Like in college, I remember my friends would always ask me, like, Hillary, where's the closest bathroom? And I'd be like, oh, boom, 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 boom. And so I just like shifted the way I live my life to accommodate this like urgency I had. And I held a belief in my mind that I have a small bladder. Um, but after I had kids, it just seemed like, no, Hillary, you know what? This is not normal. Like something, you need to do something about this. And I was in my 30s by that time. And so I sought out pelvic floor therapy. And it, long story short, did nothing for me. They treated me, in retrospect, I really was treated like cookie cutter, like postpartum mom must have stress incontinence, blah, 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 blah. Give her these exercises, have her do Kegels, bang, bang, boom. And it helped a little bit, but ultimately it didn't help much at all. And I wasn't very satisfied with the care I got. And so at this point, I was starting to get a lot more interested in pregnancy, postpartum, and really feeling generally in my life unsupported. And so I decided I'm going to become a pelvic floor therapist myself. And through that first course, I was able to treat myself successfully. And I have been on that mission ever since, just supporting women to feel more confident in their body, feel more comfortable with their sexuality, their bowel and bladder functions, and just their life in general, becoming more connected to themselves. So that's where I'm at today. I ebb and flow with my own pelvic floor problems. Personally, my pelvic floor problems are very linked with stress. They get more pronounced with stress. And when I'm more calm, they're really not present. Everyone's patterns are different. That's actually a common one, though. Okay. So, what are some common pelvic health myths? Well, one is Kegels, that like as long as you're doing Kegels, you're taking care of your pelvic health. Well, that's like telling someone, like, as long as you're breathing, you're taking care of your lung health. No, like, there's a lot more to it. Like, it's not just being alive and doing this simple contraction and hopefully relaxation. We'll get into that, that everything is fine. Not true. Leaking, well, leaking is not normal. It's a symptom of something not going right in the bladder system, which is part of the pelvic floor system. And it's just very normalized. It's considered normal through societal beliefs, but it is not normal. It's very common, but it's always something that you should be mentioning to your doctor. Case in point, me, I didn't talk to my doctor about the fact that I was leaking because I was so embarrassed by that until after I had kids, and I felt like it was more normal then. And I wonder if I may have even like described my symptoms as being more like pregnancy related. And that's why when I sought out pelvic floor therapy, I was treated more in that way, when in reality, this was actually a life, we could say like a lifelong issue. And potentially my shame and embarrassment over it led to a less than ideal treatment. So a reason I'm sharing that with you is that it's really important to destigmatize these things and talk about these things amongst friends and family. And like, it's so important to just start talking about these things. So I encourage you, if you have any symptoms that you're not satisfied with, that you start asking about it. You know, the best place to start is with a doctor, but even amongst friends and family. Okay, the pelvic floor is the pelvic floor, and it's just on its own and it does its own thing. Nothing could be further from the truth. the deeper and deeper I go into pelvic floor therapy and the understanding of pelvic health, it interacts with so many body systems, like the bowel system, the digestive system, the bladder system, the sexual reproductive system, the musculoskeletal system, the lymph system. I mean, it is just so connected to so many basic functions within our body that there is nothing in isolation when it comes to the pelvic floor. So if you're just treating the muscles of the pelvic floor and saying, okay, one and done, missing a huge part of the picture. Breath, breathing. Breathing is not related to or linked to pelvic floor problems. So often with my clients, I am starting with breath. In fact, in every evaluation I do in person, I'm observing breath before I'm even placing hands on that person or looking at their pelvic floor specifically. So breathing and your pelvic health are very linked. And what's beautiful about that is women on their own can impact the status of their pelvic floor just through their breath. So you don't need to have that much awareness of your pelvic floor to impact it for the better or for the worse, if you know a little bit about what to do, which hopefully by the end of this session, you'll have a better understanding of. Okay, I want to dive into the Kegel controversy. I used to leave this to the end, but really I'm bringing it to the front because we just need to put it out there and then let it be its thing. Not generally, across the board, what I believe is that Kegels need to be prescribed. They're very individual. Everyone's understanding and action based on their understanding of what a Kegel is different. So, but the common advice is from doctors who are, let's say, more traditionally trained, is just do your Kegels and everything will be fine. Possibly for a small percentage of women, that is completely true. But for the vast majority of women, that doctor is not checking in with how you're doing your Kegel. And that's the key. So the analogy we give a lot as pelvic floor therapists is, imagine your Kegel as like being a bicep curl. Okay. So you have to curl the Kegel in, but then you also have to relax it back out. And so many women just view the Kegel as this like upward action, like pull my pelvic floor up or pull my vagina up, but they don't really focus on the release, or they go up and they can feel that really good, but they can't really feel a relaxation. So they're always like, if this is based on, so they're contracting, relax, contract, relax, contract, relax. So they're never relaxing as much as they're contracting. And over days and weeks and months and years of doing this, what's going to happen? You're going to build excess tension. And excess tension in the pelvic floor is not a good thing. And we'll get into why in a little bit. So we really want to have a more nuanced approach to Kegels that is personalized. And the best way to do that is working one-on-one in person with a pelvic floor therapist. However, if that's not available to you for whatever reason, what I suggest is that you first shift for a period of time, let's say 1 to 2 months, of every time you do a Kegel, instead of working on the up, you just work on relaxing. So you do maybe one up and then you're like, I'm going to relax, just be. Relax, just be. So most women have built up too much tension in their pelvic floor through doing Kegels, but only doing Kegels this way and never, I'm trying to get in that little window, unraveling it. So we need to go in and we need to go out just as much as we went in. What the takeaway from this slide should be is that Kegels are just one little piece of the pie. And until you're very clear on how you should do a Kegel, you're almost better off not doing one. I think I just skipped a slide. I did. Okay. If any of you have daughters, this is a book I highly recommend for, say, preteens, like 10 to 12 years old. It's called Below Your Belt and it's by a woman named Missy Lavender. Beautiful name. And the way she describes pelvic health is pretty accurate. The only part of this that I don't completely agree with is below your belt, but it simplifies it for that audience. Anyways, she defines pelvic health as it pertains to all parts of the body, which is beautiful. Below the belt, that includes the bladder and bowel health, vaginal health, uterine health, sexual health, the muscles and structures. What I like about this is that it's not just the muscles and structures, it's all these other things. And in this book, she outlines and goes through what is normal for all of these things. Because if we don't know normal, how do we know abnormal or symptomatic? Sometimes we don't, because there's so many things that are normalized in societal talk that actually are not normal. And so we want evidence-based what is normal, and having that understanding is so important. Now, what I don't like about it is like below the belt, because I truly don't believe that pelvic health comes from just things below your belt. It is all inclusive. And that's why I call myself a holistic pelvic floor therapist, is because I am always using this as my basis. And so this is the 7 elements of holistic health. Now, through all my programs, I'm also a coach, and I don't always specifically work on pelvic floor therapy especially with coaching clients. But every work I do with everyone and in all my courses, we're coming back to this idea of the 7 elements of holistic health. And we only achieve optimal health when all 7 of these are in balance. And so I don't think optimal health is like something that we are consistently at. We have moments where we're there. Maybe if we're lucky, we have like a day or a week or a month where we really are feeling in optimal health. But it's always like this up and down, and that's normal. But it's having a direction of like, where should I go and what are all the stones that need to be turned over? So there's the first 5 are internal. So your physical, your mental health, your emotional health, spiritual health, and energetic health. And then the 2 external are your environment and social health. All of these things influence your pelvic health. We can take it to any body system. But if we keep it with the pelvic health, if I am just working with a woman, she's come to me and she has incontinence, she's leaking, and I'm just looking at, okay, the structures. You have tight pelvic floor muscles. Let's loosen those. Let's get those more relaxed. And we do that, and miraculously, her symptoms subside. But then a month later, after we've concluded therapy, her symptoms come back. And she's going, but I'm doing everything Hillary taught me to do. Well, what did I not do? I didn't turn over all these other aspects of health. And there could be 1 or 2 or 3 or 4 or 5 or 6 of those other aspects of holistic health that are influencing her incontinence symptoms. And her incontinence symptoms are not going to go away and stay away until we've overturned all of those aspects. So, yes, we focus very much on the physical aspects in pelvic floor therapy, but we must overturn all of these other aspects as well. And I think that's a sign of a good pelvic floor therapist and a well-rounded pelvic floor therapy program. Okay. Let's get into some nitty-gritty information around the pelvic floor, because that's what you came here for, right? So the 3 main functions of the pelvic floor are elimination, intimacy, and organ protection. If we think the way I love to, let's put organ protection on the side. Like, of course, we need to protect our organs. We'll get to that in a minute. But if we think about what are the 5 most essential functions of human beings to stay alive? Eating and drinking. We'll put those in 1. Eating and drinking. Peeing. Getting the liquid waste out. Getting the solid waste out. Pooping. Sex and reproduction. And sleep. So 3 of those are directly linked with your pelvic floor. That's crazy. That's huge. And if you have one of these things out of order, you are all out of whack. So for this reason only, I think everyone, men and women, should consult and see a pelvic floor therapist at least once in their life, or take a little mini course like this that gets you understanding just the basics of what pelvic health is. So just showing up here today and watching this, you are already at a higher level of achieving optimal pelvic health than you were before you started. So let's go to this organ protection side. Organ protection, I'm going to show my pelvic model here. So this is just a pelvis. The white is the bone and the red is muscles. I don't have any of the genitalia here, but the red is all your pelvic floor muscles. So this is your south pole. Okay, this is the way your pelvis is in your body. Sorry, I'm trying to get this on the screen. And if you didn't have this here, what would be happening? Things would be falling out. This is the best way, the best analogy for this is the trampoline at the bottom of your system that provides protection. So it's really strong, like a trampoline, like a nice new trampoline, but it also has this flexibility. And because of that flexibility, it's comfortable. And when the flexibility goes away, it's more like a cement floor, and that can be very painful and is often a driver of a lot of symptoms in the pelvic floor. So we want this buoyancy, flexibility, but with a lot of strength for a pelvic floor. And that is what provides ideal organ protection, and ideal functioning of elimination, and ideal functioning of intimacy with comfort and not pain. Okay, so with a little twist towards the postpartum, but these things apply across the board to all women at all stages of their life, whether preconception, pregnancy, postpartum, or well beyond immediate postpartum. So, in my experience, the most common things I see are incontinence, which is leaking of urine, stool, or unwanted gas, constipation, and I define chronic constipation as passing stool less than 3 times per week for a month. Of course, you can be constipated for a couple of days. That's not as big of a concern unless it's reoccurring over and over and over. If it isn't reoccurring over and over and over, not as big a concern. It's when you have this more chronic, every week, week after week, I don't go to the bathroom more than 1 to 3 times in a week. That's not great for your pelvic floor. Pelvic organ prolapse, the common symptom of that is feeling heaviness and pressure. We're going to get into more detail in that in a little bit. Dyspareunia is pain with sexual intercourse or of any type. So penetrative sex, oral sex, whatever kind of sexual things you are doing. If it's uncomfortable, that is not normal. Or inability to achieve orgasm ever. Not meaning every time you engage in sexual intercourse, but you're just never able to achieve orgasm or haven't been able to at the regularity that you previously were. All dysfunction of the pelvic floor. Pain in and around the pelvis, including the tailbone and pubic bone, and scarring. So this is pretty big after birth, especially with C-section or perineal tearing, episiotomies. We want to clear that scarring, not that you can make the scar go away, but you want the flexibility and mobility of the tissues to return and not to allow scars to become really sticky and hard. All right, incontinence. I think the general awareness around that leaking is not normal is growing. But there are different types of incontinence. And this is where I was really kind of led astray initially, because I was treated as if I had stress incontinence. And on occasion I do, but it's usually because I drank too much coffee and my bladder's really full. So stress incontinence occurs when there's pressure placed on the bladder. And it's with like jumping, sneezing, running, going on that trampoline, those kind of things. Whereas urge incontinence is more of this like sudden, uncontrollable urge. You immediately and urgently, urgently have to urinate. And it is more of a nervous system linked thing. There'll be triggers like you're about to get up for public speaking, or you're about to get up to bat, or you're about to unlock your door, or you're about to get up and go to the bathroom. And before you get to the bathroom, you leak. Those are urge incontinence symptoms. And then you can have a blend of the two, which is called mixed incontinence. So I think it is really important that before treatment really proceeds, that whoever you're working with does a good assessment and identification of what and why your incontinence is, what's driving your incontinence. Constipation. So I don't have more of a definition around constipation. I think we've all been constipated in our lives, and we all have kind of things that we do about it. Sometimes it's just like drinking more water, which is my first tip for managing it. But what is really important about constipation when it comes to pelvic health is chronic constipation. That just means not having nice bowel movement regularly, every day or every other day. And if you're chronically going only every 2 or 3 or 4 days, that's a problem. And the reason it's a problem for your pelvic health is there's so much more pressure on your pelvic floor. And all that pressure causes problems over the long term. So these are some quick things to just little seeds. This is not all inclusive, but upping your hydration, half your weight in ounces of uncaffeinated liquid a day. So you weigh 120 pounds, you should have at least 60 ounces of, let's say, water a day. Boosting your dietary fiber intake. What's important about this one is that you do not boost that dietary fiber intake while you're constipated, but rather immediately after you're able to clear your bowel, that's when you up your dietary fiber intake. During a severe constipation bout, fiber is like the word. Fiber bulks, especially insoluble fiber, it bulks your stool and causes more problems. Supplements to soften your stool or increase fiber. Magnesium, Calm is a brand name which has magnesium in it, but also I think things even more natural than that, like chia seeds and flax seeds and psyllium husk are wonderful, and the flax seeds should be ground. Using a squatty potty, so your posture while trying to void can be a huge game changer for women or men. Because if you're just slouching on your phone, hopefully not on your phone, but slouching on the toilet, mechanically you have a kink in your rectum and anus, and it's harder for the stool to come out. And when you elevate your knees above your hips, that kink undoes, and it's just easier for the stool to clear. And if we think back before there were toilets that you sat on, or you think in parts of the world where their toilets are holes in the floor, what do you have to do to poop? You have to squat. And that squatting posture is more natural for clearing stool out of your bowel. So using a squatty, you don't have to do a squat over a hole in the ground, but getting a squatty potty that elevates, or using yoga bricks, or using a step stool, a toddler step stool, and just putting it by your toilet and elevating your knees above your hips can be a game changer. Daily gentle movement. We've all had the experience of like going for a run and feeling like totally fine before you go for the run. And then on the run, you're like, oh my God, I have to go. And you get home and you have like a wonderful clearing of your bowel. Well, that's because movement is one of the best things for our GI system. Now, if you can't, we don't have to all be going for a daily jog in order to clear our bowel, but simply like a belly massage can be fantastic as well. And then tracking your rhythm. So if you are really someone who has chronic constipation, that you're tracking like different rhythms in terms of how much you're moving, how much you're consuming fiber, how much hydration you're getting, And when you're going, and what is the consistency of that stool? Was it really painful to pass? Is it really piecey and not well formed? Those kind of things. And taking that information to likely a pelvic floor therapist is going to be the most helpful. All right, let's go into pelvic organ prolapse. So, commonly or more conveniently called POP, it's a departure from normal sensation in the pelvic region. So, after birth, it's probably the most commonly reported. However, I think it's really important to note that 50% of women in their lifetime, irregardless of how old they are or their birthing status, will have a pop at some point in their life. So there's 18-year-olds that have never had children. They're very young, so you would expect their tissue is very mobile and elastic still. So they shouldn't have a displacement of a pelvic organ. However, they do. So the common belief is that prolapse is a result of birth and age. That's not true. And the research does not support that belief. So it can happen to anyone at any time. The next belief that is really common is that it means that an organ is coming out of you. Now, there are types of pelvic organ prolapse where, yes, indeed, and it's usually a uterine prolapse. So this is your vaginal canal and your uterus is above it, and your uterus, and this is more common with age. Okay, this is very uncommon with like the 18-year-old example. But the uterus is up here, and it does with gravity and time start to invert and will come out the vaginal canal. That is with age. And really, if there is better care provided to women earlier in their lives, particularly around pregnancy and postpartum, it will significantly reduce the risk of that ever happening, because you're rebalancing the pelvic floor, you're closing the hips. I'll get to that in a minute, from an open birthing posture to a closed pelvic posture. And you're teaching them about pressure, because ultimately the reason an organ shifts in the pelvis is a change in pressure. And certainly birth and pregnancy cause a lot of shifts in pressure, which is why this is the most common event in a life to specifically contribute to a pelvic organ prolapse. But there is a lot that can be done for this. Let me just take a step back and say the most common symptoms are incontinence, constipation, feeling like something's falling out of you, even though it may not, nothing may be falling out of you. I need to step back to that for a moment as well. That heaviness or pressure sensation and low back pain, chronic low back pain, or chronically present and then goes away. Definitely a signal of potential prolapse, and you should be screened by a pelvic floor therapist. Generally, I don't believe that OBGYNs do sufficient, thorough enough assessment of what's driving an organ prolapse. Now, okay, I'm telling you, it doesn't mean an organ's coming out of you. Let's think about this structurally. So this is your vaginal canal wall. So you have two of them. Oops, wrong way. Two of them. Okay. I only can show one. This is your bladder. Baby's coming down and coming out the vaginal canal. But as baby's head rounds the corner, it can kind of like whoop, baby's coming out, and you would expect bladder to pop back like that. It doesn't always. Sometimes it stays a little shifted and off, and that's what's driving those weird sensations, like something's falling out of me or it's really heavy. And it just shifts it. And through pelvic floor therapy, you're trying to rebalance the forces in that pelvic bowl. And that can resolve those symptoms. At the same time, you're teaching about pressure in the system, because the more pressure that is applied on this, the more likely it's going to further prolapse or move out of place. So instead of the vaginal canal and the bladder being perfectly aligned like this, now it's possible like the bladder is kind of bulging into the vaginal canal. And that's what drives that sensation of like something's just off down there. Okay. Pelvic pain. So there are unending causes to pelvic pain from like, I have a close friend that had a fracture of her pelvis. Like clearly that's going to drive pelvic pain. But it can be endometriosis, dysmenorrhea, vaginismus, just pain with intercourse, and you never have pain any other time, or a tighter pelvic floor. You have more of that concrete floor rather than trampoline floor. The point of this is that I feel like this is the type of pain that many women don't seek out support for, but it is never normal and often can be drastically improved, if not resolved, through pelvic floor therapy. Okay, so don't delay, reach out, get that support you need. And especially for my pregnant mamas in pregnancy, because going into your labor in pain is going to drive more tension and make your labor progress more challenging. So we want to get you as comfortable as possible and balanced and just ready to go and feeling good in your body before labor happens, because labor is going to go much more easily if you're balanced, you're relaxed, you don't have a lot of pain. So I'm a huge advocate of pelvic floor therapy in pregnancy if there's any degree of discomfort or pain. And in postpartum, always good. Every postpartum woman should be referred to pelvic floor therapy across the board, no matter how she births, C-section or vaginally. Everyone should be seeing a pelvic floor therapist for at least a consult. Okay, so pelvic musculoskeletal pain. So this is like where you have pain in the muscles or bones and joints of the pelvis. So the most common, and this is very common during pregnancy, is symphysis pubis dysfunction. So that's pain by your pubic bone. Whoop. Why can't I face this to the camera right? Here we go. Right here. Tailbone pain, sacroiliac pain. I'm like totally can't find the camera here. Okay, so sacroiliac joints are right here on either side of your sacrum, and it's where it combines with the pelvis. And then sciatic, that pain down your leg. Also common, but like not quite pelvic pain, is diastasis recti. And any pelvic floor therapist that commonly works with a perinatal population, pregnancy, postpartum, is highly qualified to treat diastasis recti. And these types of pains come from the added pressures of pregnancy on the pelvis, or just imbalances in how you hold yourself posturally throughout the day. And so learning what your patterns are and how to balance that out. So there are exercises I do regularly that I do way more on my right side than my left side, because my tendency is to get a lot of tension on my right. And I want to even that out so it's more similar to the tensions on my left. And then I'm more balanced in my body. But what drives that? Oh, I always cross my legs the same direction is a driver. I always pick things up on my right side. That's a driver. So starting to look at what your patterns are, and that's what I support you in doing in my course with Aligned with Birth, is recognizing and learning what those patterns are is so key for balancing and normalizing the pressures in your pelvis. And this applies to pregnancy, postpartum, and beyond. Now, I want to speak for a moment on this idea of the open pelvic position. As you go through pregnancy, your pelvis, you have more elastin in your body, and your pelvis starts to actually widen in preparation for baby to come out. I see in my practice that women who are younger, their pelvis, so let's say in their 20s, maybe early 30s, their pelvis tends to end or their first child, their pelvis seems to fall back into the closed pattern naturally and on its own. Now they get pregnant with their second baby and their pelvis does this again and everything's fine, and then it closes down again, or maybe it doesn't. So they maintain this open birthing position in their pelvis. It never closes. So now they become pregnant again. And with this pregnancy, they're like, I didn't have any pubic bone pain with my first pregnancy. And this one, I'm not even halfway through and I feel like I can barely walk. How am I going to make it? Oftentimes it's because you continue to have that open pelvic posture, which is why it's so important to work with a pelvic floor therapist in postpartum that's trained specifically in the perinatal population, postpartum population, to help close the pelvis back to its natural set point, not its pregnancy point, before you become pregnant again, because it's going to help you have a more comfortable subsequent pregnancy. So going off of the fact like, well, my pregnancy was super easy, I'm really young, and my birth was really easy, I'm fine, I don't need pelvic floor therapy. There could be little signals in your body that a therapist can identify that are telling of possible problems with the subsequent pregnancy. And I'm not talking about any severe problems, but just more comfort or discomfort. And ideally, I wish for every woman that every pregnancy is comfortable. Not the reality, but there is things we can do to nudge it in the direction of that goal. Okay, so navigating your own pelvic health. Like, Hillary, I don't know where a pelvic floor therapist is, or I don't have the funds to work with a pelvic floor therapist. What can I do on my own? Well, one, and this is the first two are the most important. Okay, familiarity, becoming more familiar with your pelvic floor, both visually and through touch. So I'm not going to do it today, but I do highly encourage women to get out a mirror and get more familiar with their external genitalia. What is what? What are the actual names? Where is everything? What does it look like? A beautiful practice. I'm going to take you through more of a somatic practice, learning about and connecting to the borders of the pelvic floor, which are your bony landmarks on your pelvis. So we'll do that in a moment. And then connecting to your pelvic floor system through breath. So breath appears. You can connect so much with your pelvic floor just through different breathing practices. And I teach these in a lot of different ways, in a lot of different in my courses, in my content, in my blog, one-on-one with clients. Breath is so important. Next is prevention. So engaging in behaviors that reduce the risk of pelvic floor dysfunction. So a good example of this is what I was talking about with constipation. So if you're someone who knows like you have a history of chronic constipation, just starting to tackle that is hugely impactful on your long-term pelvic floor health. And that you start to find ways to resolve that chronic constipation. Support is when symptoms are present that you consult with a pelvic floor therapist, or you take a course like this and try to figure out what you can do on your own, of which I've already offered a lot of ideas. So here's a couple more. So familiarity. Now I only have this little window for you to watch, but what is more important with this practice? This is a somatic movement practice for greater pelvic floor awareness, is that you listen to what I say and try to find the area on your body and then move it in the way that I say. But how I move may not be the same as how you move. So you can look at me, if you can see me in this little circle down here, or just in your mind, there's really no right or wrong way and how to move. So what we're going to familiarize ourselves with, we're going to start with what I call like the sticky outie bones. They're right up here. Technically, these are called your ASIS. And we're going to connect with those. And then we're going to go to the back and connect with your tailbone. And then we're going to come back to the front and connect to your pubic bone. I'm sorry, I lied. We're not going to connect to the ASIS today. We're going to connect to the sit bones, which are the bones that you sit on. The sit bones are the width of your pelvic floor. Okay? How wide left to right your pelvic floor is. And then the tailbone and the pubic bone is the front to back of your pelvic floor. So we're going to connect to how wide and then how deep your pelvic floor is. So first thing I want you to do is make sure you're sitting on a chair that has at least a little bit of padding on it. So if you're on a hard surface chair, you're going to want to lay down like a blanket or a towel or a pillow because your knuckles are going to be on that chair. So you're going to put your hands under your bum. I'm going to tilt my camera down now. I'm not going to tilt my camera down. I want you to listen to me. You're going to sit on your hands under your bum like this. Okay. And I want you to just wiggle around and feel for those. They're like golf ball sized bony things. Those are your sit bones. And I want you to close your eyes and just observe how your sit bones feel in your hands, on your fingers. Wiggle them around, feel that pressure on your hands. And then I want you maybe wiggle your fingers and feel how your fingers feel on your sit bones. Feel how your sit bones feel on your fingers. And then feel how your fingers feel on your sit bones. Okay, now I want you in your mind to just observe the width, like how wide apart your two sit bones are. And then imagine this basket of muscular fibers weaving in and around and between those two bones. They don't go through your bones, but they attach. Okay, now I want you to start moving. So I want you to glide your sit bones forward and backward in whatever way. So whatever part of your body you have to move to get your sit bones moving. So if this is your sit bone, you're moving your sit bone more towards the screen and away from the screen, towards me and away from me. And feel just how that feels and what you're noticing in your body, like what changes or shifts, like how do your shoulders move? Or how do your ribs move? How does your butt move when you do this? And just observing. Now come to where you started, up on your sit bones, and now go left and right. Left and right. And notice, okay, what does my pelvis have to do to make this motion happen? And what are my ribs doing? And what are my shoulders doing? And then start taking it in a circle. And just observing how it feels in your body and kind of, are you pushing more through your feet to go in certain directions? What is your pelvis doing and switch directions now? All right, beautiful. And coming back to center. Okay, now you can stand up. I think it's best for the tailbone to be standing. So I'm going to move my chair out of the way. And I am going to stand up and I'll give you a little bit more view. Now I have a dress on today, so you're not going to see a whole lot, but you will see me probably stick my bum out. So I'm finding my tailbone and I like to use my middle finger because it feels like the best finger to be on my tailbone. And we're first going to start like we did with the sit bones. I want you to, sorry, I'm fiddling with my computer. I want you to feel how your tailbone feels on your finger. Now, how does your finger feel on your tailbone? How does your tailbone feel on your finger? And how does your finger feel on your tailbone? Okay, now you can move in whatever way you need to for this. I use the doggy analogy. So a happy dog puts his tail up and kind of wags it. We're not going to wag it, but we're just going to have that like alert dog tail up. I see a bird. I'm going to go run after it. Okay, so bring your tailbone up. Alert dog. I just saw something really interesting. I want to go chase it. Now, scared dog. Bring your tailbone through your legs. And it's almost, so just compare what you feel in with your finger. So your hand's still on your tailbone. Alert dog, up, up, up. Scared dog. Alert dog. Scared dog. So focusing on your tailbone, but also subtly observing the movement. Like what changes in your hips? What changes about your butt muscles? What changes about your core? What changes about your ribs with each direction you go? You're moving back and forth. Now, let's come back to just normal standing, your hands still on your tailbone. I want you to kind of wag your tail. So you're going to bring it left and right. So you bring it left and you bring it right. And you bring it left and you bring it right. Left, and notice what happens with your core, what happens with your hips, what happens with your shoulders, your feet, your knees. Okay? Moving it left and moving it right. And now come back to the center. Now here's the fun part. Pause for a moment and I'll try to get this in the screen, in the camera. Okay. Notice this is the tailbone. I don't know if you can see this very well, but the tailbone actually has little joints. It has 1, 2, 3 little joints. Okay. So a joint is a connection of a bone. It's soft tissue. So we're going to, now I wouldn't expect that any of you are actually going to feel your tailbone move. Some people can move their tailbone. But I want you to imagine that those joints in your tailbone are a lot more like your finger. So I don't want you moving your hips. Your body's not really moving. You're more like using the power of the mind to influence the state of your tailbone. So in your mind, I want you to imagine and try to raise your tailbone up like that alert dog. Now try tuck it between your legs and raise it up like the alert dog and tuck it through your legs. Now, as you're trying to go through this range of motion, observe the changes you feel in your muscle tension and where you feel more tension when you try to raise it up and where you feel more tension when you try to tuck it between your legs. And now where you feel more relaxation and opening when you try to raise it up and where you feel more relaxation when you try to tuck it down. And now bring it back to its more neutral position, wherever you think that is. Don't worry about if you're right or wrong. And now you're going to try to wag your tail to the right without actually moving your hips. Okay, so wagging to the right and wagging to the left. So you're trying to pull your tailbone to the right. Pull your tailbone to the left. And notice, do you feel anything contracting in your body to do that and pulling to the right? What do I feel? And just observing. That's why I'm not telling you what you should feel, because there's no shoulds. There's just observing here and pulling to the left and coming back to the middle. Okay, let's move to pubic bone. So again, somatic movement, we are just observing what happens. There is no right or wrong. It's just observation. So I'm telling you the movements to do and cueing you on what you could be observing. You observe for yourself in your body. You experience this for yourself in your own body. Let's end with your pubic bone. So finding your pubic bone, placing your hand on it right there. So with your pubic bone, this is similar to the tailbone. It's very strong joint, doesn't move a whole lot. But we're going to take it through a similar movement. So first, we connect in by observing how our pubic bone feels on our fingers and how our fingers feel on our pubic bone. How our pubic bone feels on our fingers and how our fingers feel on our pubic bone. Now, I want you to take your pubic bone and try and move it as far away from your chin as you can. And now I want you to bring it as close to your chin as you can. Bring it far away from your chin. And bring it so close to your chin. Now, as you go through this movement, notice the muscles that contract as you bring your pubic bone away from your chin towards the floor. And then now the muscles that contract to bring it up to your chin and away from your chin. Now, what is your pelvis doing as you do that? Towards your chin, away from your chin, and towards your chin. Now stop halfway in between. Now try to bring your pubic bone to the right and to the left and to the right and to the left. And what changes in your body to move it to the right versus the left? And observing, how am I moving? What is being influenced when I move my pubic bone in that way? Now bringing it in a circle, drawing a circle with it. What's moving? What's contracting? What's relaxing? Go as slow as you need to observe. I encourage slower movement over faster movement. And now the other way. Beautiful. A couple more. And just observing that, connecting to that pubic bone and where it is in space. Now bring your free hand to your tailbone. Last thing here, connect in to that distance. And you can move around if you want to, of where the distance between your front hand and your back hand. So your front hand on your pubic bone and your back hand on your tailbone. I'll give you a quick view of like what I'm doing here. So I have my hand here and I have my hand here. And I'm just kind of observing this distance right here and tuning in and creating this proprioceptive, or where you are in space, this mental map of that distance. And then the same, if you want, I'll show you that. You really kind of have to bend down, stick your booty out, and feel that the sit bones and that feeling that width between the sit bones. And then coming back to the space and have a seat. And just taking a moment as you sit down to connect in with your pelvis and just observe like how much more awareness, like when I tell you your sit bones, like do you immediately have a map in your head now of like where your sit bones are? And okay, where's your tailbone? Can you feel your tailbone? No, you're not touching. Can you feel your tailbone? Can you tuck your tailbone? Can you be the scared dog? Can you be the excited alert dog? Very good. And then your pubic bone, what is your pubic bone doing? Is it center? Is it a little more to the left? A little more to the right? Where is it? Map it. Beautiful. And being able to know where your pelvis is in space at any moment, or being able to connect to it more easily. Maybe you have to touch it. That's fine. Touching increases proprioception. I'm most aware of this part of my body right now as I touch my hands. The pelvis is a mysterious part of our body, and so many people are not connected to it at all. So that was a fairly long sequence, but even just like each morning connecting, like, let me feel what I feel in my sit bones. Let me feel what I feel in my tailbone. Let me feel what I feel in my pubic bone. You can also use, we didn't do your sticky outie bones, your ASIS, those front top hip bones on either side. You can do those as well. Okay, I'm going to move on to connection. And this is another practice. So if you have a yoga ball, or not a pregnancy ball, whatever you want, an exercise ball like that, beautiful to sit on that. I tend to just sit. I have basically like a dining room chair and with some pillows on it. It's padded, but I just kind of sit on the corner and I straddle, and my legs are kind of far apart like the women in this picture. Now, what we're doing is trying to cue in to how our breath and our pelvic floor connect. And as we breathe, how our pelvic floor responds to the breath. So ideally, now you may not observe this today, and that's okay. But ideally, and what is normal for your pelvic floor and your breath is when you inhale, your lungs are expanding, so your breathing diaphragm comes down. And so should your pelvic floor. So you should feel your pelvic floor come down or descend or become heavier onto the surface you're on. And then with your exhale, your breathing diaphragm contracts and rises to help the air go out of your body. And so should your pelvic floor slightly rise or become less heavy on the surface you're sitting on. You're not doing a Kegel contraction or any active contraction beyond just breath. So start by closing your eyes. And just observing the breath flowing in and expanding your body. And then as you exhale, observing how your body gets smaller, and imagine that rising of the diaphragm, the breathing diaphragm. And then inhale, it expands, everything expands. And then exhale, everything comes together. And then inhale, it expands, more pressure comes into your body. Exhale, that pressure releases and becomes less as your lungs expel the air. Inhale and exhale. A couple more, just focusing on that expansion with the inhale. Exhale, becoming smaller, rising. Now with your next inhale, see if you can observe a lowering or making heavier sensation through your pelvic floor as you inhale. It's kind of more of an opening too, downward onto the surface you're on. And then as you exhale, like this gentle rising or lifting of the pelvic floor, not a Kegel. Inhale, a lowering. Exhale, a rising. Inhale, a lowering. Exhale, a rising. Beautiful, beautiful. Keep going for a few more breaths, trying to observe the lowering as you inhale. A little bit more heaviness through your south pole. Exhale, that heaviness subsides as the pressures rise. Inhale, descend. Exhale, rise. Inhale, descend. Exhale, rise. Couple more on your own. Last one. Beautiful. Okay, so if you had a lot of difficulty connecting in with that, that is totally normal. So many of us are not connected to our pelvic floor, but it is through our breath that we can achieve a connection. So I encourage you to come back to this, even doing 3, 5, 10 breaths a day where you try to connect. It is helpful, of course, to have some pressure through your pelvic floor. So you kind of want to be rocked forward and having that pressure through your perineum, or the space between your vaginal opening and your anus. Sometimes I used to have a picture on this slide of a woman kind of kneeling with yoga bricks under her. So she was sitting on the yoga bricks and she's kneeling. That's another fabulous posture for this. Sitting on a corner of a chair, just make sure it's soft and gentle under your perineum and it's not a really rigid, hard surface. It's going to be a lot more harder to perceive. And in time, I'll connect into this sitting in the car or just sitting normally in a chair. Okay, but it takes practice to get there and that connecting to your pelvic floor. Okay, let's go to prevention. So, of course, we all know prevention is the best medicine. So, the development of habits that routinely support pelvic health and maintain or help you ebb and flow to and from optimal pelvic health is ideal. For the purpose of this workshop, I'm not going into great depth about that. However, the two practices we just did are prevention. Those don't really treat anything. Those just build awareness, and building awareness of something is the first step to preventing. You can't prevent problems from happening if you're in a certain area, if you're not even aware of that area. However, I had a course I think it's almost 2 years ago now since I've released it, called Pelvic Health Essentials. So this summer, my endeavor is to redo Pelvic Health Essentials with the most updated information in my knowledge base of pelvic health and holistic health, and release that in September. And that course was all about building habits. So building knowledge, increasing awareness, which today you just started those baby steps. Coming back to those 2 exercises, I highly advise. But then this course is much more in depth and goes deeper into a lot of what I talked about today, and helps support you in building those habits. All right. And support. So support can look many ways. Support can be just this workshop. Support can be a short telephone call to ask your questions and set a plan for yourself with me. Or support can be virtual or in-person pelvic floor therapy with myself or any pelvic floor therapist in your community. Through this little workshop, I hope you have a better idea of how to identify a fabulous pelvic floor therapist versus a more physical oriented pelvic floor therapist. So I offer a free consult for pelvic floor therapy, potential in-person pelvic or virtual pelvic floor therapy clients. That's about a 15-minute call. And then we would do an evaluation and intake. Ideally, my support for pelvic floor therapy clients is that we can do an initial in-person visit, and then we proceed, if we need to proceed virtually, that is good. I can do it completely virtually. However, there are some elements that we can't go as in depth in because I can't place my hands on you. However, the beauty of it is that you are asked to place your hands on you. And so you are learning about your body along with me. And it's a very interesting process that I love. But in person, of course, is always best. And then treatment is just, we just proceed through what we find, the imbalances, the patterns you're holding that maybe aren't helping to optimize your pelvic health. And we work through those or try to resolve the symptoms that you have that are unwanted. Okay. So I use a holistic whole body approach to preparing and healing your pelvic floor before and after birth. The most commonly treated conditions I see are basically what I reviewed in this workshop. And like I already stated, I could do virtual and in-person options. So I thank you so much for joining today. If you have any questions, please reach out to me, and there are the details down below. And make sure I have placed also several resources below for you to refer to and have more practice with. And I have also pulled out the practices we did today, the somatic experience and the breath experience. So if you want to just go back to those and practice those on your own, but that's all you want to watch, but you want to have a guide, you can just click those and watch those. And then there's the slides available for your notes and questions, and reach out to me. And thank you for being here today. It's been a pleasure.